health on this Wednesday. We're talking about being allergic to Wi-Fi. What? Joining us to talk about this is Dr. Richard Chaffoo. Okay, Dr. Chaffoo, one, I've never heard about being allergic to Wi-Fi, but apparently it's really a thing. A woman in France was just awarded $900 a month, claiming that she suffers from this electromagnetic hypersensitivity, basically being allergic to Wi-Fi. What are we talking about here?
Well, it's interesting, Jen, you know, that we don't really know how common it is, but we think that maybe it's 2 to 3 per million people seem to have symptoms, and what these people claim is that they have very vague, non-specific symptoms like headaches, nausea, fatigue, muscle weakness, rashes, and their claim is that these symptoms actually occurred with their exposure to electromagnetic radiation, such as you said, from Wi-Fi's, could be cell phones, microwaves. You know, they're ubiquitous, certainly in hospital environments. Now, the problem is, Jen, that there's really no recognized syndrome that medical science, nor even on an international level, the World Health Organization, have found that really truly link any of these electromagnetic radiation exposures to any disease or syndrome. And again, the symptoms are so very non-specific and vague that it's impossible to take the symptoms that someone has that are so vague like that and assign them specifically to something like a Wi-Fi exposure.
Right. Let me, I know, and we made a graphic of some of the symptoms. I want to put that up again and get your medical advice there, because when we look at some of those symptoms, I mean, that could be like you feel hungover, or
exactly.
you didn't drink enough caffeine or something. I mean, so how do you as a doctor say, yeah, this actually is a thing, or maybe you're kind of overreacting? Well,
you're right, Jen, and actually in medicine we always have a little phrase, you know, common things are common, and when you hear hoofbeats, you don't expect to turn around and see a herd of zebras. You expect to see a herd of horses, and so you're quite right. I mean, most often those types of vague symptoms could be associated with a plethora of diseases, you know, a lot of which could be benign. I mean, you could have a viral illness, a flu, you could have had a heavy party night, you could have some more serious illness, but certainly nothing specific, and most importantly, no real cause and effect relationship between any type of electromagnetic radiation of any kind and a specific syndrome.
I know that besides that woman in France, I was reading that there was a woman in Massachusetts who was something similar. She basically told the school that her son was getting sick because there was so much Wi-Fi around the area. Dr. Chaffoo, how do we differentiate between, say, something like this, and we do all these medical stories about, for example, cell phones could potentially cause cancer? I mean, do you think that there is something to this? We just may not know about it all the way yet?
Well, we may not know the whole story, and you know, medicine is a continuum. We get information, but we're all scientists, so we always base our medical decisions upon hard science, clinical studies that are reproduced in very well controlled studies. And so that's how medicine moves. It seems like it may move at a snail's pace to the public, but the reality is it's done to protect the public so there are no, you know, overreactions and we're not subscribing symptoms to some disease that really doesn't particularly exist. And so in the end, science is really based upon hard, cold facts, reproducible studies that are done in multiple university controlled situations, and that's really how we have to approach things related to a cell phone causing damage or Wi-Fi.
Right, and at this point we're just not quite there yet. Interesting conversation though. Dr. Chaffoo, great to have you as always.
It's good to see you, Jen.
All right, get over to Jason Hanman, a man who is allergic to the ocean, to working more than 4 hours a day.
And anything risky.
Yeah, see, the Wi-Fi waves really, you know, make me, you know, I can't work more than 4 hours a day. Live here at La Jolla Shores, we are looking at the waves. You know, the rip current danger does remain in an elevated state. Things are going to start to calm down along the coast as we look ahead to Friday. Right now, you're getting the high